Assalamu alaikum. Hello everyone, my name is Amna and welcome back to my YouTube channel. As a pharmacist, I'm very passionate about sharing my knowledge and expertise with you through this platform on this channel, and you can expect to find more videos about a variety of topics related to pharmacy and much more. I also want this channel to be a space for engagement and discussion. So if you have any question or suggestion for future videos, please don't hesitate to leave a comment and send me a message. Thank you for joining me on this journey, and let's get started. One, the main cause of digitalis toxicity is diabetes mellitus, hypertension, hepatitis, renal failure. Option D, renal failure can contribute to increase the risk of digitalis toxicity when a person has impaired kidney function. They may not be able to eliminate digitalis from their body at efficiency as normal kidney function, leading to build up the drug in the system and increased risk of toxicity. However, it's important to note that the overdose of digitalis medication is still the primary cause of digitalis toxicity. Question 2. Digitalis arrhythmia can be treated with lidocaine, quinidine, procainamide, propranolol. So the correct answer is quinidine. Option B. Why? Digitalis-induced arrhythmia can be treated with some of the medication listed, but lidocaine is not typically used to treat the condition. Quinidine is a medication that is often used to treat arrhythmia, including those that are caused by digitalis toxicity. It works by blocking certain electrical signals in the heart, which can help to regulate the heart rhythm. Procainamide is another medication that can be used to treat digitalis-induced arrhythmia. It is also works by blocking certain electrical signals in the heart. Propranolol is a beta blocker medication that is often used to treat high blood pressure and certain heart conditions, but not digitalis-induced arrhythmia. So the correct option is B. Lidocaine can be used to treat certain types of arrhythmia, including ventricular arrhythmia, but it is not preferred a treatment for digitalis-induced arrhythmia. Digitalis-induced arrhythmia are typically treated with medication that can be counteract the effect of digitalis on the heart, such as quinidine, procainamide, potassium supplement. Being said, it's important to note that the specific treatment of digitalis-induced arrhythmia may be depending on the severity of the arrhythmia and the patient medical history, condition, and other factors. One is used in ventricular arrhythmia with heart block, phenytoin, procainamide, rate of binding, therapeutic volume. The correct answer is procainamide. Why? Procainamide is a medication that is commonly used in the treatment of ventricular arrhythmia with heart block. It works by blocking a certain signal in the heart, which can help to regulate the heart rhythm and improve the heart block. Otherwise, phenytoin is an anti-seizure medication that is sometimes used to treat certain types of arrhythmia, but it's not typically used to treat ventricular arrhythmia with heart block. So the correct answer is option B, procainamide. Question 4. Which one is anti-arrhythmiatic class 1A? Disopyramide, propranolol, verapamil, propafenone. So the correct answer is disopyramide. Why? The anti-arrhythmic medication that belong to class 1A is B, disopyramide. Class 1A anti-arrhythmiatic drugs are sodium channel blockers that are used to treat arterial and ventricular arrhythmia. They work by slowing down the electrical impulses in the heart and reducing the excitability of cardiac cells. Disopyramide is a class 1A anti-arrhythmiatic medication that is used to treat ventricular, supraventricular arrhythmia. Phenytoin is an anti-seizure medication that is sometimes used to treat certain types of arrhythmia, but doesn't belong to a 1A class. Propranolol, as I told you in previous question, and verapamil and beta blocker, calcium channel blocker medication respectively, they are used to treat certain type of arrhythmia, but not belonging to the class 1A anti-arrhythmiatic. And propafenone, class 1C anti-arrhythmiatic medication is used to treat supraventricular and ventricular arrhythmia, but does not belong to class 1A. So the drug belong to class 1A is disopyramide. Anti-cancer derived from vinca alkaloid is cyclophosphamide, fluorouracil, doxorubicin, cisplatin, and none of the above. The correct answer is none of the above. Yes, vinca alkaloid type of chemotherapeutic medication that are derived from the periwinkle plant. These medications work by distributing the molecular microtubulars in cancer cell, which are necessary for cell division and growth. The two most commonly used vinca alkaloids in cancer treatment are vinblastine and vincristine. Vinblastine, these medication is used to treat various types of cancer, including lymphoma, testicular cancer, and breast cancer. Vincristine, this medication is used to treat a variety of cancer, including leukemia, lymphoma, and sarcoma. Therefore, neither cyclophosphamide, fluorouracil, doxorubicin, nor cisplatin derived from the vinca alkaloid, so none of the options provided are the correct. So the option E. And further, the anti-cancer medication derived from the vinca is not listed in the options, so none of the above. Number 6, the solution contains 9 ppm of NaCl. The concentration of the compound is in the solution. Option A 0.9, 0.09, 0.009, 0.9, 0.009, I mean quarter 09. To calculation you can see 1 ppm is equal है 10 lakh, 1 million. ठीक है, 1% containing 1 by half 100. 1 ppm into the person you can convert 0.001%. So the same is if you are converting into 9, then the same is for 9 ppm solution. Hope you understand. Again, I can repeat for you. The concentration of a solution is typically expressed in terms of the amount solute compound per unit volume or per unit mass of the solution. In this case, the concentration of NaCl in the solution is 9 ppm per part million. This means there are 9 parts of NaCl for every 1 million of this solution. To convert this concentration to a decimal form, we need to divide the number of parts of NaCl by the total number of parts in the solution. Simple. You can divide it and then you got the answer. Option D is correct. Which one used to treat trigeminal neuralgia? Digoxin, carbamazepine, prazosin, reserpine, and clonidine. Clinodine. The correct answer is carbamazepine, with famous brand Tegretol. Okay, so why? Trigeminal neuralgia is a type of facial pain that is caused by irritation or damage to the trigeminal nerve, which is responsible for the sensory information in the face. Carbamazepine is an anticonvulsant medication that works by reducing the sensitivity of the trigeminal nerve, which can be help to alleviate the pain association with trigeminal neuralgia. Carbamazepine is first line medication for the treatment of trigeminal neuralgia and is usually effective in reducing or eliminating the pain in most patients. However, with any medication, it may not be suitable for everyone, and some people may experience side effect or find that is not effective in controlling the symptom. Therefore, it's important to consult with the health provider, obviously. Not. So, yes, option B is correct. Process required CYP450, hydrolysis, oxidation, glucuronidation, deamination, and sulfuration. The correct answer is B, oxidation. So cytochrome P450 is a family of enzymes that are involved in the metabolism of many drugs and other xenobiotics, foreign substances in the body. These are enzymes primarily located in the liver, but they are also found in some other tissue, intestine and lungs. One of the primary functions of CYP450 enzyme is to reuse drug and other substances in order to make them more water soluble and easier to eliminate from the body. The oxidation process involves the addition of oxygen atom to the drug molecule, which can alter its structure and activity. Therefore, the correct option from the given choice is B, oxidation. Hydrolysis, glucuronidation, and deamination and sulfuration do not require CYP450 enzyme. Option which is not true. Chemical property here, its option. Reversible physical property, irreversible, A plus D. Yes, you are correct. Its option is not a chemical property and nor an irreversible process. So if you see option A, chemical property, is not correct, as absorption is a physical process, not a chemical process. Option D, irreversible, is not correct, as the absorption can be either reversible or irreversible depending on the type of absorbate and absorbent interaction. Physical absorption is usually reversible, while chemical absorption is irreversible. Therefore, the option A and D both are correct, and the correct answer of the question, absorption which is not true, is option E. Steady state concentration during IV administration, directly proportional to volume of distribution, inversely proportional to volume of distribution, directly proportional to infusion rate, inversely proportional to total body clearance. C and D. The correct answer is C and D. Why? The steady state concentration refers to the point at which the rate of drug administration is balanced by the rate of drug elimination, resulting in a constant drug concentration in the body. During IV administration, the steady state concentration is directly proportional to the infusion rate and inversely proportional to the total body clearance. The volume of distribution is not directly related to the steady state concentration during IV administration. So, volume distribution is a pharmacokinetic parameter that relates to the amount of drug in the body to the concentration of the drug in the plasma. Therefore, option A and B are not correct. Option C is correct. And the steady state concentration is directly proportional to the infusion rate. Option D is also correct, as steady state concentration is inversely proportional to the total body clearance. Thank you so much for watching this video. I hope you found it informative and helpful. If you have any question or suggestion for more future videos, please don't hesitate to leave a comment or send a message. And if you enjoyed this content, please consider subscribing to my channel and turning to the notification bell so you don't miss out any future videos. Remember, taking care of your health is one of the most important things you can do yourself. Thanks again for watching. I will see you in the next video.